just started. How many times has it happened so far?
Singular.
Singular, one event. What I would do, I would keep a close eye on this. I would just keep a close eye on this, and make sure you maintain a diary and see
Okay.
what basically happens next. I am concerned that it could be what we call simple partial seizure, meaning during this time, patient do not lose consciousness. Patient are not completely out of it, but they are in a zone where they basically have no control.
Yeah.
And they are not able to control certain part of the brain function because of extra electrical activity.
Okay.
Now, after stroke, seizure happens in 30 to 40% of the patients, and seizure could be in any size, shape, and form. The classical seizure we all know is shaking, eyes rolls up, people fall down. That's extreme form of seizure.
Oh gosh.
But we do not need to get that kind of seizure. It could be minor, what sounds like what you had.
Okay.
Like a partial seizure.
It's called partial seizure, simple partial seizure.
Yeah.
It's the lightest and mildest form of seizure. So don't kind of think too much about this thing. The seizure sounds more like a stigma, like oh my God, but it is just an electrical storm in your brain, and that's pretty much it.
Okay.
Most people who get this kind of concern on a regular basis, like if they have no medical problem, the first seizure is discounted, meaning we don't have to treat them.
Oh.
But considering the fact you have suffered a stroke, and still I'm concerned about that, I personally think it may be wiser to treat that preemptively, without thinking too much or waiting for this thing to happen again.
Oh, okay.
What are your thoughts about this?
That's right.
I think it's better to be proactive.
Yeah.
And I'll tell you the reason to be proactive. There are some people who basically just want to confirm things, and I'm talking about physicians who just want to confirm and do a bunch of testing, and it'll take 6 months. And next thing we know, while you are in the therapy, something like this happened, and you fall down and injure yourself.
Yes.
So I think it is important for us to be preemptive, proactive, and treat that as long as you don't get side effects. So I'm still going to offer you the testing, some basic testing of EEG, electrical wave testing, and we will repeat your MRI one more time just to be cognizant what has happened and how does your brain look like, just because we also want to have a clear baseline how things were before and in the future for comparison from apple to apple. So those testing will continue on parallel track. But I'm going to bypass waiting for a result and digging through the detail and crossing through the zone of uncertainty. And I'm going to offer you a seizure treatment, a lighter dose seizure treatment with a presumption that this most likely sounds like seizure, which I can't discount the fact because it happened just after your stroke.
Okay.
Okay. So the medication I'm going to give you, it's a pill. The name is Keppra, and it is one of our blockbuster medication. It is very effective. It's easy to use. Only challenge with the pill is it actually has some side effect that most people do all right if they keep taking it, and the side effect is kind of feeling sleepy, loopy, and also sometimes some patients feel depression. But let me reassure you, I'm not going to give you a hefty dose. I'm going to start with a gentle dose, a smaller dose, and then you will have extreme flexibility to reach out to us so we can adjust the dose accordingly. So in a nutshell, even if you feel slightly off for next 5 to 7 days, you should keep taking the pill, partly because once you and your body get used to it, I
Okay.
think you'll feel all right.
Okay.
Sounds like
Okay.
the right thing to do.
Uh-huh.
Yeah.
What questions do you have for me?
What?
I don't know.
I just have a couple. Maybe one was
Yeah.
we have she was actually getting dressed to go to therapy at Madonna yesterday. She's still an outpatient there, and we're down to like our last 6 or 8 insurance visits. But they wanted to have they wanted to have like an evaluation after this incident, like sent to them so they could feel comfortable taking her.
You know, we're happy to send this note to them, and we will write down the fact that she is cleared for the further therapy at Madonna as well.
Good.
And there are no major restrictions
Okay.
from our side, so that should be clear.
Okay.
And
Okay.
in case if they're delaying your care, let me give you my cell phone. You can tell them to call me directly so they don't delay your problem. How
Okay.
about
Perfect.
that?
Perfect.
You know, these fax and machine and copying, it
Yeah,
takes a
I know.
while,
It gets lost in the facts.
Yeah.
right? If you sense that there's a problem and they're not taking care of things quickly, ask them to call me on my cell phone. I'll give them a verbal recommendation.
Oh,
Thank you, Doc. And then the other thing, just related to that, was if you had any advice for how to environmental things or things that we need training with, considering we might expect this will happen again, or anything to be aware of from a caregiver perspective.
Nothing necessarily. There are no major changes to expect from what's going on from an environmental situation. I think the goal is to get her through, the first year of this recovery. That's when the maximum recovery will happen. Optimum recovery happens between day 1 to day 90, and then it slightly slows down for a younger patient like you up to 6 months, and then it will be a slow recovery beyond that up to a year. So I think the most important part for you is just to make sure you are able to go to therapy. And with this COVID situation, I think the best thing I can tell you to do is social distancing, and that's pretty much it.
Mm-hmm. Mm-hmm.
We have learned that patients who have stroke, as a history of stroke before they catch COVID, if they happen to catch COVID, they require prolonged hospitalization. Their need for intubation or the ventilator is almost twice than usual patient.
Wow.
And those kind of things. So specifically in what's going on in today's environment, my only recommendation would be just wear proper mask, take proper caution, wash your hand properly, wash your face properly, and try to have social distancing as much as you can. I understand there are certain restrictions, but this distancing applies to your extended family and towards your friends. Okay.
Yeah.
That's the only thing I had to add.
That's great to understand better, because when I was talking to her about this, I told her I didn't think she was at a higher risk because of her type of stroke, where it was from an injury.
So what we have learned is this virus actually can travel through the artery and go to the brain. So the patient who have suffered a stroke in the past, irrespective of their age, condition, diabetes, hypertension, risk factor, having an insult to the brain in form of stroke puts them at a higher risk of having a complicated course. We just wrote a new paper on this thing, and we have submitted this thing to one of our premium stroke journal, Stroke. So it's under review right now.
Okay,
And
it's good to know that.
that's what we learned. Stroke patients are twice at a higher risk of not changing, but kind of having a prolonged and complicated course of COVID-19.
It's the best warning we ever could have got. Thank you so much.
Welcome. Absolutely. All right. So let me summarize a few things for Lindsay so she can help you further.
Okay.
For Lindsay, this is going to diagnose going to be simple partial seizure. Semiology is what I described. The kind of feeling of discomfort followed by this action and no motor movement, no loss of consciousness. And in this event, I would just get EEG as an outpatient, MRI brain with and without contrast as an outpatient. Yeah. With and without, just because if there is a subacute ischemia, that will be evident on with contrast, so it will be slightly different than our stroke protocol.
Okay.
And I would give her a 500 milligram twice a day Keppra dosing. So start with one pill twice a day. And Lori, if you do all right with this one pill twice a day,
Okay.
after a week, you can increase the dose to 1.5 pill
Okay.
twice a day.
Okay.
So that should be good enough.
Okay.
And then, Lindsay, we should check back on her in a month.
1 month. Okay.
Yeah.
Okay.
Wow.
All right, guys.